Welcome to our channel's question and answer series. We will cover mitral stenosis in this video. Let's jump straight into the questions. What is mitral stenosis? Mitral stenosis is a valvular heart disease characterized by the narrowing of the mitral valve orifice. This narrowing impedes blood flow from the left atrium to the left ventricle. What is the primary cause of mitral stenosis? The primary cause of mitral stenosis is rheumatic fever, an inflammatory disease that typically follows an infection with group Streptococcus bacteria. Rheumatic fever primarily affects children and young adults, particularly in settings with inadequate access to medical care. What is the pathophysiology of rheumatic mitral stenosis? Rheumatic fever triggers an autoimmune response that primarily affects the mitral valve, causing inflammation, scarring, and leaflet thickening. This results in commissural fusion and a narrowed orifice, culminating in mitral stenosis. The progression from rheumatic fever to symptomatic mitral stenosis often unfolds over decades, typically presenting in adulthood. What are other causes of mitral stenosis? In addition to rheumatic fever, the causes of mitral stenosis include congenital valve defects, mitral annular calcification, endomyocardial fibrinostosis, the sequelae of malignant carcinoid syndrome, systemic lupus erythematosus, rheumatoid arthritis, Whipple's disease, and Fabry disease. What are the symptoms of mitral stenosis? Common symptoms include exertional dyspnea, orthopnea, paroxysmal nocturnal dyspnea, and profound fatigue. Patients typically report increasing shortness of breath with activity, which in advanced stages may occur even at rest. Palpitations are commonly reported, often related to atrial fibrillation, which frequently accompanies mitral stenosis. In severe pulmonary hypertension, patients may develop hemoptysis. Lastly, the risk of thromboembolism, including stroke, is heightened in mitral stenosis. What are the signs of mitral stenosis? Signs of mitral stenosis include a malar flush, accentuated first heart sound, and in some cases, it can be palpable at the chest wall. Following the second heart sound, listen for the opening snap. The hallmark of mitral stenosis, however, lies in the diastolic murmur. This low-pitched, rumbling sound is best appreciated with the bell of the stethoscope at the cardiac apex. If the patient is in sinus rhythm, you may also detect a presystolic accentuation as the atria contract to bolster ventricular filling. In cases of advanced disease, the pulmonary component of the second heart sound can become pronounced. Evidence of right ventricular hypertrophy can manifest as a palpable heave along the left parasternal region. Finally, don't forget to look for signs of systemic congestion, engorged neck veins, an enlarged liver, and edema of the lower extremities. What diagnostic tests are used for mitral stenosis? The diagnosis of mitral stenosis involves a combination of clinical assessment and mainly echocardiogram, and possibly cardiac catheterization if non-invasive tests are inconclusive. How is the severity of mitral stenosis classified? The severity of mitral stenosis is classified via mitral valve area, mean diastolic pressure gradient, evidence of pulmonary hypertension, NYHA classification, and Wilkins score. A normal mitral valve area ranges from 4 to 6 cm squared. Mild stenosis is indicated by a mitral valve area greater than 1.5 cm square. Moderate stenosis by a mitral valve area of 1 to 1.5 cm square, and severe stenosis by a mitral valve less than 1 cm square. The mean diastolic pressure gradient adds context. Less than 5 mmHg is mild, 5 to 10 mmHg is moderate, and over 10 mmHg is severe. Pulmonary hypertension, suggesting advanced disease, is defined by a systolic pulmonary artery pressure exceeding 25 mmHg. Symptomatic assessment using the NYHA classification also informs severity grading. The Wilkins score, considering valve morphology, may determine treatment suitability, with higher scores often indicating a less favorable prognosis for percutaneous intervention. This multifaceted approach is pivotal for the management of mitral stenosis. What are ECG findings of mitral stenosis? ECG findings indicative of mitral stenosis include P mitral, suggesting left atrial enlargement, right axis deviation, and signs of right ventricular hypertrophy as evidence of pulmonary hypertension. and atrial fibrillation, reflecting atrial dilation and fibrosis. Additionally, a first-degree atrioventricular block may be observed. How is mitral stenosis managed? Mitral stenosis management involves medical, interventional, and surgical approaches. Medically, diuretics alleviate pulmonary congestion, and rate control medications optimize cardiac output. Endocarditis prophylaxis and anticoagulation are key for complication prevention. Interventionally, percutaneous mitral balloon valvotomy is favored in selected symptomatic patients with suitable valve morphology. Surgically, valve repair is preferred, but replacement is an option for those ineligible for repair or percutaneous mitral balloon valvotomy. The choice between mechanical and bioprosthetic valves is tailored to the patient's profile and anticoagulation suitability. Is active rheumatic disease considered when planning surgery? Yes, active rheumatic fever must be adequately managed prior to surgical intervention to prevent the recurrence of valve dysfunction and to optimize surgical outcomes. What are the potential complications of mitral stenosis? Potential complications include heart failure, stroke, and pulmonary hypertension. What is the prognosis for someone with mitral stenosis? The disease progresses slowly, but symptoms can worsen rapidly without treatment. Survival rates are significantly lower if pulmonary hypertension develops. Thanks for tuning in. If you've enjoyed or learned something new, please give us a thumbs up and don't forget to subscribe for more content. Share your thoughts in the comments below and join us again soon.